Hi everyone. Imagine making a life and death situation and a condition when decision when you are sleep deprived for 30 hours. For most of the professionals, it sounds like torture, but this is training in medicine, right? And if you look at the data, 1/4 of the resident doctors are stressed, and more than 46% of them are working equivalent to 2 full-time jobs. And this data is even more skewed for resident doctors, where the numbers, if I come closer to the screen, is like 56.7% had burnout, 84% reported stress, and 51.8% reported sleep quality. These are not just stats for me. For me, it's personal. As a mother of a resident doctor, I always wonder why. Like when sleep is medicine for most of us, why is it luxury for our doctors and the healthcare providers? So today I'm going to talk about how you can, I don't know whether you can address this, but how you can little bit help our healthcare providers with autonomous agents. My name is Sapna Grover, and I'm the Director of Cloud and AI Practice at Microsoft. Before we get into the topic, a brief intro about myself. These are some of the logos that define me. I grew up in India, did my engineering from here, did my master's from Harvard, did a management program from Kellogg's and ISB, and then during COVID did a master's in AI from Purdue. Started a career as a defense scientist in DRDO, went to the US in startups, then I came back to India to set up the GCC Center for Pegasystems, and since past 8 years I've been in Microsoft AI world, and that's what I'm most passionate about. How can AI solve real world problems? Personal front, I'm a passionate yoga instructor and a practitioner. My family, all techies, but for some reason my daughter decided to become a doctor. And coming back to the topic real quick, we know it's evolving at a very fast pace. Imagine your experience, shopping is digital, travel booking is digital, even all your rest of your banking is digital. But when it comes to healthcare, as a patient, I do expect, and 70% of the healthcare consumers, they want their reports, prescriptions, all the records to be electronic, right? But still, we end up repeating the same information at every step. While 80% of the US providers are spending high amount of time, high amount of investment. In the past year, they've spent on increasing IT spending, but still it's not enough. We talked about the burnout already, and in the previous talk, we heard about the importance of data, but the fact is that 97% of the healthcare data is unused because it's living in silos and it is not connected. And on an average, a hospital generates 50 petabytes of data in a year alone. So with this also comes, like, not only these are the challenges, but there's also a challenge to remain secure, and the data has to be compliant with the ever-growing compliance demands and needs of different countries and organizations. See, AI is already transforming healthcare. We saw a beautiful talk in the past as well. And most of the talks are about models, algorithms, or data. But beyond this tech, there's a beautiful, when you look beyond the tech, you see some numbers which are really, really starking. AI in healthcare is there to save lives. It's there to reduce errors. And most importantly, which I can't emphasize enough, it's there to reduce the time spent so that our healthcare professionals have the most precious commodity, which is time. And time in healthcare is not just a productivity gain, it is compassion, it is better care. Right, so let's just talk about what's happening across the globe and then about the AI agents, which is the core of this talk. So AI adoption is accelerating, no doubt. 2025 was the year of agents when everyone was talking about agents. And 2026 is continuing in that journey where we are trying to make agents really, really real. And if you look at these data, some of these stats are from 2025. There was a prediction that by 2028, we'll have 1.3 billion AI agents joining the workforce. This number, I'm pretty sure it's going to far exceed that basis the trend that I've seen already. And then Microsoft also conducted a work trend report or work trend survey, where 81% of the leaders say that they are going to be using AI agents within the next 12 to 18 months. So this year is where I'm seeing a massive, massive transformation happening. And since I come from the tech background, 99% of developers are now, or those who are working in AI space, are building agents or working on agents for others. And then if you see the report from Gartner on the right, 90% of the software engineers' code is actually going to be written using the code assistants. This is something that I see day in, day out within my organization as well. And then 82% of the organizations are talking about leveraging this within their organization within the next 1 or 2 years. But what exactly is an agent? Show of hands, how many of you know about agents already? Quite a few folks. So agents are basically a piece of software which where you provide a goal and it performs the task autonomously. But there's a spectrum, right? And to explain that, I'll explain it in the context of medical lingo as well. And these are not technical terms, these are just for explanation's sake. Imagine the retrieval agent is like your medical intern. So you are, as a doctor or senior consultant, asking the question, what is the latest prescription or what are the latest guidelines for steroid-based some disease or management of the disease. So what does the medical intern do? Does the research on up to date, goes and checks the literature, comes back with the report. That's a little retrieval agent in simple terms. When you give the task, they'll go retrieve the information and get the task done. That can be done via an agent as well. Now moving towards the next step, which is on the task-based agent. They're able to do some tasks. So I would equate kind of a task-based agent as similar to a junior resident, where the consultant or the HOD says that okay, prescribes few CBC, LFT, KFT, whatnot, and create a discharge summary and schedule a follow-up in 2 weeks. So the task is done. The intern would, or the resident, junior resident would come and get the signature from the HOD at the end of the process. And then comes the autonomous agent, which is in my view equivalent to a senior resident or a junior consultant who's posted in an ICU setup. They're autonomously monitoring it. They know what to do. The moment there is a deviation from whatever the standard numbers for BP or any other parameters is, they're going to kickstart the protocol and of course call the senior consultant if they need any assistance. So that's autonomous agent in action. So you can imagine how as the complexity increases, the agents go through a journey from simple to advanced agents. And these agents are already getting deployed in some of the workforce. It's not about the knowledge that's different for these agents. It's the level of autonomy and responsibility that's given to these agents. That's how they gets differentiated. So now let me talk about frontier firm. Again, a term that has been used in industry. People have heard this term? Not yet much. So frontier firm is basically in terms of healthcare, you'd imagine a healthcare frontier firm is an organization where AI agents are joining the workforce similar alongside with the physician, nurses, consultants to make the patient's outcome better. But how do you actually do it? So the journey actually goes in phases. Phase 1 is where every employee in the organization, be it healthcare professional or outside, they have an assistant at their disposal, which is helping them assist with the tasks that you identify to make them more productive and to get the time back. Second thing that's happening is that they are joining the workforce. In industry, we are talking about from org structures to work structures. So imagine in your org structure, you have an agent reporting under you, handling some of the tasks, and as a agent boss, you are making sure that they're doing the tasks right, and when they go wrong, you have a capability to address and correct them. So in the future, the phase 3 is going to be, we are getting in the direction where a lot of business rudimentary tasks are going to be done by the agents, and of course humans and the senior expertise is going to be in the loop, and that's where you define the level of autonomy that you want to provide to these agents. Now the emerging frontier firm, first as I mentioned, human with the assistant. This is where we are talking about, again going back to the same survey that I mentioned earlier. This is mainly being used to address the capacity gap in healthcare. 70%, so this again was a survey done in 2025, 51% agreed that the productivity must be increased using these tools, and more than 79% of the healthcare leaders in this space also mentioned that they are considering leveraging AI agents to do this for their organization. Human-led agents, of course, everything comes with a cost and a lot of complexity around it. It's not as simple as it might sound. So the optimal balance in terms of, not only in terms of the compliance and other things, what should be the right structure, optimal ratio between a human and the agent, so that the cost doesn't overrun as well, because these models are expensive. You have cloud compute considerations as well. But healthcare professionals and the leaders are turning it because it's towards it is because of the 24/7 availability, the speed, and then you can also brainstorm with these agents in terms of ideas. And last but not the least, when we're talking about how they are moving through the spectrum, a lot of healthcare industries are pivoting towards, making this as a skilling initiative for their organization. This is part of their strategy as well. And then they're also hiring for AI specific roles in the healthcare sectors as well. Well, how do you go ahead in this? Of course, hire your first digital employee, learn, set the optimal human to agent ratio, and get onto the board. How exactly do you do it? In the previous talk, we heard about variety of data and how data is key. So hospitals, as I said earlier as well, on an average produce 50 petabyte of data, and 97% of it is unused. The data is spread across silos. So the first step is getting all these unstructured multimodal data. Multimodal is which is available in text, images, and whatnot. Getting all this data in single place so that you can reason, draw insights on top of it. And then strong data foundation is essential to build any type of AI and agents specifically. And then there's a cost associated with it. It's $1 trillion opportunity that we are sitting on, like with this unlocking this potential of the data. Of course, there are several cloud platforms. I'm representing Azure. The first step is, of course, to unify your data. Then next step is to empower your team, fuel the innovation with the AI-ready data, and of course, it's extremely important to safeguard the sensitive data, which is personal information and compliance that is a must-have. So how does an healthcare organization become a frontier provider? It's 4 steps. It starts with the first step of enriching the employee experience, which is all about making them productive, getting the agents in the hands of your workers so that they have bandwidth. Second is to reinvent the customer experience, which is in this case the patients. And then you reshape the business and finally bending the curve on the innovation. With this, thank you everyone.